Hi everyone, my name is Mariah. 안녕하세요, Mariah Emnita. I'm here to give you my three-month update on my plastic surgery experience with BT Plastic Surgery. All right, the first question is, what kind of surgery did you do? I had a lot of revision work done. So I had my genioplasty done for the third time, as well as having my jaw cut ever so slightly just to match with my chin so that there's not a step, which is a little hard to explain. You can ask the surgeon what a step is. Anyway, I also had my nose done for the second time, as well as a full face fat graft. So I did my cheeks, my nasolabial folds, my temples, and my forehead. I also had a little bit of bone cement put into my jaw because when I had my very first reduction surgery, they over-reduced the jaw and the doctor wanted to even it out so that it's an equal width on each side. And then the very last thing that I had done, which was not surgical, but was still a procedure, was an egiocel, which is, I had a little bit of filler put underneath my eyes just to give me that youthful, happy glow and that kind of smize where you smile with your eyes. Also, just in case anyone is curious, I have been having lymphatic drainage massages done, and that is what all of this bruising is here. So please excuse my bruising. Anyway, the next question is, what made you decide to get rhinoplasty? The very first time I got rhinoplasty was because I had a rather large hump nose at it was pretty humpy. It was really large, wide nostrils. It did not look great. So I just wanted to straighten out my nose and reduce it and just kind of get that kind of Barbie line looking nose. That first surgery did not go well. They over dissected my nose and left me with a wider nose and a very flat bridge and uneven nostrils, and I couldn't breathe as well. It was a really bad surgery. So the second time around, I wanted to build my bridge back, even out my nostrils, improve my breathing, and then I wanted that Barbie line rhinoplasty. So if you'll see, I have a swoop to my nose. I don't like straight noses. I love a little swoop. I think it's very youthful, very feminine, very adorable. I have a lot less nostril show. My nostrils used to show quite a bit, and now when you look at me head on, it's a normal amount. And from the side, it's not too much. I think I have like just the most beautiful, perfect, adorable little button Barbie nose. I'm so happy. So thank you to Dr. Sungmin Lee. Please excuse me if I got that incorrect. What did you emphasize to the doctor the most for your surgery? Nose shape, line, etc. So when it came to doing my chin, I wanted a shorter chin because I had a pretty long chin. And it was pretty boxy, so I wanted that nice, beautiful V-line. And I also wanted to bring my chin forward. As you'll notice, it now has a nice projection to it. Not too much, not too little. It matches with my nose, with my lips. It looks perfect. I didn't have that before. It was very flat, very boxy, and now it's just a beautiful, perfect V-line. He matched my jaw to go with it. It looks so beautiful, so well done. So those are the things that I emphasized. And then as far as my nose went, I wanted to reduce my nostril show. I wanted to build my bridge, and I wanted to make sure that I had a swoop to my nose. Those were the three most important things to me. How would you rate your nose 5 out of 5? What are you most happy about? 10 out of 5. I think my nose is gorgeous. I also had, one other thing that I emphasized when getting my nose done was I wanted an alaroplasty. An alaroplasty is where they actually go in and they cut the nostrils and reposition them, usually to make the nose smaller and reduce nostril show. So like I said, 10 out of 5, I'm very happy. When you look at me straight on, I don't show too much nostril. When you look at me from the side, I don't show too much nostril. I'm so happy. I have my swoop, I have my bridge. I have a very well-defined, cute little tip. It's not pinched, it's not too wide, it's not too skinny. The doctor truly did such a beautiful job. When do you feel like you had rhinoplasty the most? For example, I don't see my nostrils showing from the front when taking a selfie. I love my side profile. When do you feel like you had rhinoplasty the most? I think they're asking, when do you feel like you like your rhinoplasty the most? Yeah, I think it has to be straight on. Straight on is my favorite, or just directly from the side. I think it looks very beautiful. My side profile or my front profile. What was the most difficult part after having rhinoplasty? I think the most difficult part after having rhinoplasty was probably having my nose packed for 3 days. I absolutely could not breathe anything out of my nose. It was completely packed. So you have to mouth breathe. So I highly recommend, depending on where you're coming from, you can also shop around at different pharmacies while you're in Korea. Just not all of them have them. It actually took me a while to find it, but you want to find an oral gel that stays in your mouth and it keeps your mouth moist so that you don't dry it out. Because if you're mouth breathing and you're sleeping, you're going to dry out your entire mouth, your entire throat. It's going to wake you up in the middle of the night and you're going to be so disturbed. You're going to drink water. I think I was waking up every 10 to 15 minutes the very first night because I didn't have the oral gel just to wet my mouth. So please, please, please make sure to have that. You will thank me later. What is the one tip you can share when you have those difficult times during your recovery? Yeah, that's the tip that I have to share. Oral gel. Please get oral gel. It will save your life. Can you briefly explain what made you decide to get facial bone contouring? I had a very boxy jaw originally. It was completely boxy. My chin, my jaw, it was very strong. It was very masculine. I just wanted a more delicate, feminine looking jaw. And I think V-lines are just, they're so soft and so feminine. I can't rave enough about how happy I am. What are you most satisfied about after the surgery? / what is the main difference after the surgery? I think what I'm most happy about has to be my jaw and my chin. Back in 2018 was my very first time getting surgery on my jaw and chin, and things did not go well whatsoever. Like one side was cut, the other one wasn't. It was over dissected. They exposed my nerve canal. I had nerve damage. The second time around, I had double jaw surgery, and that just made matters even worse. And I was just left with an uneven jaw and a very boxy chin, and it had no projection to it. It didn't sit well with my profile, and it left me depressed for 6 years. I wore a mask hiding my face every single day for 6 years. So coming to BT plastic surgery and meeting Dr. Lee Ho-bin, who made me feel so confident and comfortable and well taken care of and heard the whole time, never rushed, never felt to feel like another patient or just another paycheck. He has changed my life for the better. I absolutely cannot thank him enough. I feel the most beautiful I've ever felt in my entire life. I will never touch my chin or my jaw again. I'm beyond pleased. The main difference after surgery has to be, yeah, maybe my profile. It sits so beautifully. I don't know, everything was such a drastic change from my jaw to my nose, but it was drastic in a great way, in a way that I wanted. When you're filling out your form, they specifically ask, how much of a difference are you looking for? Are you looking for a subtle difference? Are you looking for something that people will notice? Are you looking for a dramatic change? And I put down a rather dramatic change. I wanted, I truly wanted a new look, and it came out for the better. All right, let's see what's next. Please specifically share your recovery process weekly. What was the most difficult part? I would say week 1, of course, is the most difficult part. That's the most painful. That is where you swell the most. You're getting used to what it feels like to have so much pressure in your face. Yeah, week 1 had to be the worst week of them all. By week 2, the pain had subsided, and it was more so a little uncomfortable to open my jaw, but it didn't hurt anymore. By week 3, the discomfort was starting to go away. Something else I noticed in week 2 was that my face was very tight. My jaw felt very tight, my nose felt very tight, it was hard to smile. My whole face just felt very, very tight. By the time week 3 came around, I was starting to the tightness was starting to release a little bit. And by week 4, I was pretty comfortable. I was opening my mouth comfortably. I was moving my face around comfortably. I was brushing my teeth comfortably. Yeah, I would say that patience is going to be your best friend. Remaining calm, not panicking, just trusting the process, listening to every single order the doctor gives you, and give yourself time to heal. But yes, if you can make it past that first week, take your pills on time. They provide you with everything that you need, from antibiotics to pain pills to anti-inflammatory. Just take everything on time, drink lots of pumpkin juice, lots of water, make sure you're getting exercise, you're walking every day, not too much, but just enough that feels comfortable, and make it past week 1, and then it's smooth sailing past there. But the most difficult part, I would say, was waking up immediately after surgery. I think that was the worst part for me, just because I woke up in so much pain and so much discomfort, and I couldn't breathe, and my mouth was dry, and so I highly recommend that you have a support system there with you. Make sure to ask the nurses, the translators, doctors, whomever you can, to call your family, call your loved ones, call your friends, and make sure that they are there when you wake up, so that you feel comforted and you don't feel alone. Because if I didn't have my sister there and Christine, which was my English translator, I don't know if I would have made it through the first night. Could you please describe your deswelling process? Let's see. I have to think back. I maybe should reflect on some photos. The first week, like I said, is going to be a very worst week. That's where the most swelling is, the most pain, the most discomfort. By the time week 2 came around, my face I was starting to see the shape of my face a little bit. And I would say the part that took the longest to deswell was my nose. The nose takes absolutely the longest. You have to be so patient when you get a rhinoplasty. Swelling moves downwards. So if you were to maybe get surgery on your forehead, the swelling is going to move all the way down your face. So when you're getting your nose done, the whole thing is swollen, but then this part starts to deswell and it starts to define, but your tip holds all the swelling, and it just sits there and it sits there. Even now, I'm just shy of 3 months. I would say my tip still has just a little bit of swelling, but I'm still very happy with where it's at. I think it's very beautiful. But yes, please be patient with swelling. It does take a while with rhinoplasty. Bone contouring, I would say, is quicker than the rhinoplasty. Please make sure that you are following the doctor's instructions and you are wearing your compression garment that does reduce swelling so much. It is so incredibly important to wear your garment. Do not wear it too tight. You will reduce blood flow. The point of it is to compress and increase blood flow. So make sure you're wearing it as many hours as they say, not too tight, not too loose. Make sure it's comfortable and you're consistent. And I think you only have to wear it just for the first week. So like I said, just get through that first week and you will smooth sail from there. Is there any episode to share regarding your swelling or bruising? For example, my dog didn't recognize me, my Face ID didn't work. My Face ID didn't work on my iPhone. Even after my face deswelled and I could finally see I could start to see the shape of my face and the shape of my nose, my Face ID worked maybe half of the time. So I ended up having to just delete the old one and make a new one. But remember, that was because I asked for a dramatic result. Yours doesn't have to be dramatic. You can still you can ask for something subtle to keep your features, something soft and subtle. So please do not be discouraged by my journey. I specifically asked for something dramatic. Let's see. How much of sensation is back / can you eat well? So my very first surgery, like I said, I had nerve damage from here to here. So my lip and my chin, I could not feel, and I still cannot feel. It is permanent at this point. So I could only feel from here to here. When I had double jaw surgery, everything went numb. My upper lips were numb, my bottom lip was numb, but my right side came back, thankfully. A little, I'd say about 90% of it came back my second time around. And my experience with Dr. Lee Hobin at BT Plastic Surgery, I had no numbness. I'm not saying that this is going to be your journey, but for me specifically, I didn't have any numbness, and I was absolutely taken aback. I was so surprised I didn't have any, so grateful, so happy. So I have all of my sensation. Dr. Lee Hobin is so skilled and he's so careful about making sure not to touch your nerves. So please feel rest assured that you are in good hands. As far as eating well, yes, I can eat very well. I would say my very first week, what I did was I went to the pharmacy before I had surgery. I picked up some nutrition shakes, a big box of pumpkin juice, and that was my meal every day, round the clock for the first week, just because it was difficult to open my mouth. First thing in the morning, pumpkin juice, nutrition shake. Lunchtime, pumpkin juice, nutrition shake. Dinner, pumpkin juice, nutrition shake. Snack time, pumpkin juice, nutrition shake. There's not a lot of calories in the nutrition shake, so please make sure you're drinking them round the clock. And pumpkin juice and water. Keep yourself hydrated. What did you miss the most in terms of food? I think maybe my first and second week, what I missed the most was crunchy foods. You can't eat anything hard or crunchy. And I love, who doesn't love texture? Who doesn't love crunch? So I really missed that. So make sure you're eating soft foods and you're being gentle with your jaw. Do you remember what was going on in your head at the operation room? I do remember. I remember very well. All I could think was, please let this be my last surgery. As my third time touching my chin, my third time touching my jaw. So much there was just so much going on with nerve damage and open canals, and all I could think was, please let this be my last time. I can't revise it after this. It would just be too risky, and I don't think any doctor would take the chance to revise it. And here I am, so grateful to the doctors, and everything turned out perfect. Why BT? that's a really great question. As far as why BT, just give me just one moment. I'm so sorry. All right, the next question is, why BT? As for why I went with BT, a huge part of that, and I can't thank her enough, the majority part of it has to be my English translator, Christine. Huge shout out to Christine. Hi, I hope you're doing really well. I can't thank you enough for being so patient with me and consistent and making sure that I was truly informed. Christine talked me through every doubt and every question I had. She was consistent with communication. She was patient. She never rushed me. She even stayed late after work. She really took her time with me to make sure that I was comfortable and that I was well informed and that I was making the best decision for myself. The other clinic that I had in mind was DA plastic surgery. I won't go into too far of detail as far as what happened, but I would just say I had a much more positive experience at BT. So Christine, thank you so much. I trust you with my life. You guided me in the right direction. 감사합니다. Let's see, what's next? How was the aftercare and the service at the clinic? 10 out of 10. Excellent. I had to come into the clinic the first 3 days after surgery. I stayed the night in the aftercare facility, which I highly recommend staying the very first night, just so you're monitored, you're getting IV, you're being fed, you're getting pain meds, you're being taken care of. Highly recommend. It is very affordable. And then the first 3 days after that, I had to come in for antibiotics, and they also offered me a de-swelling therapy for free, and I thought that was so kind. So I got my antibiotics. I did my red light therapy for de-swelling. I was always warmly greeted. I always saw Christine, and regardless of who was my translator, everyone always welcomed me in with such a warm greeting and smiles, and made sure I was so well taken care of. And even after I finished the antibiotics, I'd still come in for de-swelling treatments, as many as I needed. It was very, very generous. Any questions that I had, I was always promptly answered. One thing that you'll find is with some clinics, they could go a little silent after they do your surgery or after they collect your payment. And with BT, there was always consistent communication. There was never a moment where I felt, I'm sorry, I lost my train of thought. There's never a moment where I felt ignored or looked over. And all of my concerns were addressed, and I was always just very well taken care of. The next question is, how much do you think your concern/complex got better after the surgery? Everything I wanted was addressed and taken care of. So 10 out of 10 again. Everything was addressed. It went great. I'm happy. I'm so happy. The next one is, what did you want to do the most after surgery? What I wanted to do the most after surgery was look in the mirror and smile back at who's looking back at me. I wanted to show the world my new face. I still plan to go to modeling auditions. I'd love to try my luck at modeling again. And yeah, I think just smiling back at myself was the most important, to be able to take a picture and look at it and admire myself and be so content and happy and overfilled with joy and zealous seeing myself in the mirror and seeing myself in photos. What was your friends and family's reaction after your surgery? I keep a very close-knit circle of friends. So they're very honest with me. If they felt something was off, they would tell me. And each and every one of them said, you were beautiful before, but you look absolutely incredible now. They're like, I didn't even know you could get more beautiful. They're like, I don't know where the ceiling is with you, but you look incredible. You look the best you've ever looked. So they were very thrilled and very excited, very happy for me. It was such a positive experience. Everyone was very excited for me. What's your message to those who are considering surgery at BT or in general? My message is to very, very carefully think about what it is that you're looking for. Are you looking for a V-line? Are you looking for something subtle? Are you looking for something dramatic? Do you want a straight nose? Would you like a swooped nose like mine? Would you like a fat graft? You have to very thoroughly communicate what it is that you want so that the doctors understand and you're on the same page. I truly trust the doctors, asking them for their advice as far as what they think would look best on me, but you know yourself best and you know what's going to make you the happiest. So please thoroughly communicate what you're looking for, and they will deliver and make sure that you are on the same page, and they will go over the surgery plan at least. I think we went over it between maybe 3 times just to make sure everyone was on the same page. So be very careful, very communicative, and very thorough. I think that's all of the questions. So I just want to say that I am so grateful for each and every one of you at the clinic. Thank you to the manager. Thank you to both of the doctors. Thank you to Christine. Thank you to Yurda. I believe that's how you say your name. Thank you to everyone who greeted me, took my photos, everyone who was part of this journey. Thank you so much. You have changed. You have changed my life for the better, and I can't be more grateful. I feel the most beautiful I've ever felt in my entire life, and like I said, thank you. I can't thank you enough. I wish you all well, happiness, health, success, love. Please take good care of yourselves at BT Plastic Surgery and take the chance to becoming a more beautiful, more confident, happier you. All right, everyone. Bye.